Happening now, the coronavirus pandemic has led to huge changes in the way healthcare providers care for their patients, including patients who require cancer care. 16 News Now reporter Ibrahim Samra has more on what those changes are.
COVID-19 has had a huge transformation on how healthcare providers care for cancer patients, and one doctor says it may be a while before they start seeing patients like they used to.
We want to make sure that our patients are safe.
Cancer care has not been quite the same since COVID-19, and Dr. Thomas Reid, the medical director of the Memorial Cancer Center in South Bend, says it may be a while until it's back to normal.
There's the White House CDC guidelines, the American Society for Clinical Oncology, and Center for Medicare and Medicaid Services all have guidelines in terms of when we should resume ramping up.
And Reid says that time is not now. In fact, all cancer screenings for non-critical patients are currently being delayed. Also, appointments for patients who have recently completed cancer treatment are being directed via telehealth. Now, the fear of COVID-19 spreading to patients and or physicians is also causing clinics to reduce and put off rounds of chemotherapy based on each patient's condition.
There's the issue of what's the risk-benefit ratio. Yeah, 12 cycles is the standard, but if we do 12 cycles, we may have more patients who are immunocompromised and increase the incidence of COVID-19. So in the setting of COVID-19, just because we're in the pandemic, we don't not give chemotherapy. We have to do the risk benefit for each patient.
However, anyone in need of urgent care or have high-risk chronic conditions is allowed to see a physician in person as long as they follow common safety guidelines like washing hands and wearing a mask. If you are at high risk, Reid says there are some things you can do at home that could help improve your condition.
Take your medicines, optimize your medical management. That's number one. Number two is do all the things everybody else is supposed to be doing. Cover your coughs and your sneezes with your elbow. Wash your hands. Social distance 6 feet. Avoid crowds. Stay home.
Now, Dr. Reid says despite some of the limitations that healthcare providers have had to endure, cancers that are life-threatening in the short term will be treated immediately. Now, anyone with any questions about cancer care can call Beacon Cancer Care at 574-647-8300. Again, that's 574-647-8300. Reporting in South Bend, Ibrahim Samra, 16 News Now.